So this is a technology that I've been using for about a year now that's utilizing 3D CT scanning imaging and then computer generated osteotomies and then customized jigs for the patients to perform forearm osteotomies. So this is a patient of mine. He came in, unfortunately, he had an unstable both bones forearm fracture, and an outside orthopedist had looked after it, hadn't followed him perhaps as closely as would have been ideal, and he had this malunion. I followed him over a 2-year period, and he came to me with a very specific complaint of pain when he supinated to catch with his baseball glove. And for him, this was the worst thing in the world, that he couldn't play baseball. However, if you look at the deformity, it's a fairly mild deformity. His mum also hated the bump that he had on his ulna, on the ulnar border, because it was rounded. So I felt that this was a perfect indication for trying to use something that enabled increased precision in the correction. So this particular technology uses bilateral forearm CTs with a 3D reconstruction, transposing the right normal arm as a mirror image to make it the left arm. And then you've got the blue and beige images there, and you can see the deformity. The computer then goes about and creates the osteotomies with the assistance of an engineer. Then we put the plates onto the bones, and then we reverse engineer back to the deformity to then create drill guides and then saw guides in order to use them intraoperatively to correct. And you drill before you saw in this particular instance. And as you can see, that we managed to create very nice anatomic reconstruction with this technology. I also had another patient who was 16, and he was managed with intramedullary nails for both bones forearm fracture. And he had a really poor range of motion both in pro and supination, and I couldn't really understand why. And if you look at his x-rays, his biceps tuberosity is not opposite his stylo, despite having a good AP and lateral of the elbow. And when I looked at that, I really couldn't work out how to restore his motion, exactly whether this was a pronation or a supination deformity, because he just had terrible motion. And so I did the same technology again, and if you look, he's got a 70-degree pronation deformity, but he wanted more pronation. And so in actual fact, this 3D planning told me that if I just corrected the bony deformity back to normal anatomy, I probably wasn't going to achieve what the patient wanted, which was increased pronation, because he was a rower and he needed to be able to row with his hands in. So I went, go the other way. I went about doing his planning, whether I needed to do radius and ulnar or just radius, and I really felt that it was a radial deformity. I didn't think that the ulnar deformity was much, so I went ahead and just did a radial deformity. I ultimately didn't use the 3D printed jigs and the like, because I wouldn't have achieved what I needed to. I just, in this case, brought the radius away from the ulnar. So then I had another patient who had a distal radial malunion, and he had a problem that every time he supinated, his wrist clunked and he had wrist pain. And this was, again, a very subtle finding, and I used the same technology in order to plan his. If you look at the green, that's the after the osteotomy. You can see that the distal radial ulnar joint is congruent and the radius moves around. If you look at the upper left, you can see that you can almost see that it's congruent when he's pronated, but when he's supinated, you can actually see that the ulnar is not actually sitting in the distal radial ulnar joint. And so I did his osteotomy, radius only, did not address his wrist, and his wrist pain and clunking went away. And so I think that this is a useful technology. I think that it may be more useful for the subtle deformities more so than the complex deformities. I think the complex deformities, we have a different set of priorities in what we're trying to achieve for the patient. The 3D plan is not the answer. I actually spend more time thinking about these patients. I think the 3D plan takes some of my planning out of the operating room to doing it before, but I think I now spend longer planning the surgery. And overall, I think that this has been a good addition to my practice.